Welcome to your weekly pulse of wellness. I am your host, Tobi Adetayo, a dedicated folk physiotherapist with a passion to helping you live pain-free, healthier, and a more vibrant life. Whether you're just bouncing back from an injury or looking to level up on your fitness journey, this podcast is your one-stop shop to practical insight and expert tips. Each episode will be bringing you science-backed strategies to helping you live better, feel stronger, and thrive every day. Today we'll be speaking on occupational therapy. What is occupational therapy and what is the role of occupational therapist in patients recovery?
Okay, thanks for inviting me. My name is Ifeoluwa. And to describe what occupational therapy is an healthcare profession that helps to promote independence and well-being through the use of occupation. That is what we do as occupational therapists is to help people regain their lost function after an injury or an illness. Thank you.
Say after a stroke or an injury, why can't they just go home and rest?
Well, the reason why they can't just go my race is because they still need to do the things that are important to them. They still need to live a meaningful life and a purposeful life, just like every other person. So after an illness or injury, we need to ensure that they get back the function that they've lost as a result of the injury. So that's our work. We ensure that okay, if they were able to feed themselves before, if they were able to take their bath before, and after the illness they are not able to do it again. So that's where we come in as occupational therapists.
Oh, just to be clear, so occupational therapists practically handles the occupational part of our daily life. I mean, technically, our daily living, the way we brush, the way we carry new things, the way we write, I guess.
Yes, everything we do, every activities we perform daily to survive.
Oh, right. Can you give us a real life example of the patient that you have helped get back to life?
So we have a lot, but for the sake of time, I will mention like two, a male and a female. So we have a male that was he had a stroke. So and after treatment, as a result of the stroke, he could not drive again because the left side of the body, sorry, the right side of the body was not really functioning well. The right hand and the right leg. So he could not drive and he could not write, and he's a person that needs to be signing because his work, the kind of work he does, requires him to sign regularly. So he could not do those things, and he came to us as an occupational he came to us in the occupational therapy department, and after like 2 months of session with him, started making attempts to drive with monitoring. So he started making attempts, and after like 3 months, he could drive on his own. And then we did handwriting training also for him. So after some months, he could also write and also sign by himself. So we had another case of mental illness. So as a result of mental illness, the woman could not remember a lot of things. And she's also a trader. So she needs to make some calculation. For example, if you come to buy something from her, she needs to know the amount of change you will get and stuffs like that. So she could not do those things after the mental illness. She could not remember things in the past, and she was not able to do calculations that is required of her due to the work she does. So she came to us as an occupational therapist, and after some months of session, we did some cognitive training for her, and she was able to remember some things, and then she was able to do some form of calculation. So she went back to her work, and little by little she started gaining. those function.
Wow. Your profession is really encompassing because I myself isn't aware that you you don't just deal with fixing the arms and the legs in itself. So you help people with their mental capacity to regain mental strength as well.
Yeah, of course.
Wow, that's good. That's good. Well done, man. So like I mentioned, people only think occupational therapist. In fact, for people that know occupational therapy, they think it's just about the arms and the legs. You've given us example of someone you manage with that has mental deficit a bit. Is there any other example that you can give us that is relating to that is different from hands and legs?
Yes, of course, when it comes to occupational therapy, it's not just about treating arms and leg, it's about helping patients to regain function. So it's not just about the physical aspect alone. So we have so many people, even apart from, we have some children that are autistic. So we also treat those kind of children. If you see autism patients, you will not know that something is wrong with them physically, because most times they don't have physical disabilities. But we know as occupational therapists that there is more to them rather other than the physical aspect. We know their social interaction is affected, their sensation is affected. So we deal with all those things too. So we have so many autistic children we are treating, and we've recorded so many success. We might not be able to achieve everything that we want to at a time, but with time, as they come, as they are consistent with therapy, we'll be able to achieve some little things that are important to
That's great.
them and
That's
to
great.
their
Thank you. So, I understand that in patients management, it's more beneficial to work with other medical professions. So, how do you team up with, say, physiotherapists, doctors, and nurses to manage patients?
Okay, so where I work, there's something we call MDT. That's multidisciplinary team. So we have like a team where we have the physiotherapists, the nurses, doctors, psychologists, and so on. So when we get a referral, sometimes the first contact might be the doctor. So after the assessment of the doctors, if they see that okay, this patient might be in need of physiotherapy, occupational therapy, then they refer to the appropriate quarter. So if they notice that the patient might need an occupational therapist, they refer to us. And sometimes the patient comes to us directly in occupational therapy. And if we also notice that the patient has a medical condition and they need to see a doctor, we refer back to the doctor. And also, if they need physiotherapy, we refer to the physiotherapist. So it's a multidisciplinary thing. We work together and we ensure that the patient gets the maximum treatment needed.
All right.
Thank you.
Thank you very much. So, in all of this,
Yeah.
are you first contact specialist? I mean, can patients walk up to you directly? Can they come to your department directly and seek help?
Yes, of course. So we get referrals even from other hospitals. Then there are some that, okay, probably a patient that has seen us and gotten a good result can refer someone else going through the same thing and tell the patient to come to occupational therapy. So we come, there are sometimes that we get referral directly, that we become the first contact, and sometimes we get referrals from other professionals like doctors, physiotherapists, and so on. But sometimes patients also come to us as first contact, referred from other hospitals or by their colleagues, by their friends, and so on.
Okay. So, what's the one mistake family make that actually slows down the recovery? And um, what should they do instead?
So one of the major mistake families make is that they don't come to us early. They wait for the condition to get worse. They might still be thinking that okay, this thing can be managed. Meanwhile, early rehabilitation makes it better. It makes rehabilitation to work faster and it makes it more effective. So one of the major mistakes is they make is that they don't come early for rehabilitation. And another thing is that they are not consistent. For some people, they come for therapy and sometimes they will come this month, and by the time you see them again, maybe after 2 3 months, if they get some little relief, they stay back, and by the time the situation now gets worse again, they come back. So inconsistency is another mistake people make. So when they come to us, we always advise them that if they want the treatment to be effective and faster, they have to be consistent, because if they are not consistent, it affects our work.
So, inconsistency and procrastination, one problem we face in medical health generally. So, patients procrastinating on when to see professionals. It's a big issue, but then we can only advise patients and their families to take things seriously and as early as possible, and always stay
Yeah.
consistent with the treatment plan. Right. So if someone is listening right now and is struggling with daily tasks after illness or injury, what's the first step they should take to get an occupational therapist involved?
Well, unfortunately, we have only few facilities that have occupational therapy. So, but then around, if they can get an occupational therapist around them, most likely it can be found in the hospitals. Some some of us work in special needs centers, work in hospitals, special needs centers, schools with children with special needs. So you can get an occupational therapist there.
All right. Thank you very much for your time. So, listeners, you've heard it. You might have been struggling with some daily activities. Just know that you need an occupational therapist as much as you need a physiotherapist, because they work hand in hand. We help to bring you back to your feet. They help you to function on your daily activities. Thank you again, Ifeoluwa. It's nice to have you here. Yeah, listeners,
You're
thank you
welcome.
also for joining us today. Um, we'll catch you on the next episode of Pulse of Wellness. I remain your host, your one and only sport physiotherapist with a passion in making you live better, live pain free, and thrive every day. Bye.